the second one is an EMT. So an EMT is important to our company, of course, because of the danger that is involved with our company. We'll have an EMT full-time, either at our home base, which they'll be able to dispatch out if need be, or they'll be on site for more of our risky adventures. So they'll be a first responder if an emergency does happen before other emergency services can get there. And the approach that we take with them is a biological approach. So we want them very well rested and feeling well and good to go out and save lives. So we make their job as easy as possible while they're not in an emergency situation, as you can see with the Lazy Boy chair. So that's our two jobs.
So since Adrenaline Adventures is so specialized in our field, we are going to need as many applicants as we can, and that's why we have all three different ways of recruiting. So for the first one is direct applicants and referrals, and that usually produces the most desirable applicants because they're the most, it's like the word of mouth, you get the best ones. But the problem with that is there's not very many applicants in that sense. And that's when print and electronic ads come in. It's really cheap and efficient, and you do get a lot of applicants. The problem is that they're less desirable, and you're going to need to sift through all the applications. And that's the same thing with the high schools and the universities. You're going to have a lot of applicants, but a lot of people that have no idea what they're doing. And the business that we're in, we're going to need people that know what they're doing. So for the job preview, that's kind of where it comes in. You really want someone who is into that kind of business, the thrill seeking. And so to provide a realistic job preview, we're going to have to be very direct and to the point. We're not going to be able to dance around and dilute the potential dangers that come with the job, as well as the responsibilities. So we're not going to want to have someone on the team that is just there just for the money. We're going to have people that want to be there, that have the training to be there, and have the desire. But like I said, if you get someone that wants to be there, then it's perfect for them. And that's where the enjoyment factor comes in. And, if when we're interviewing someone, we can ask them what they've done for, the heli skiing or whitewater rafting, and if it seems like they're actually into that, then it will be a pretty realistic job preview.
Selection area. The first thing we're going to need to do when it comes to selecting people to work for us, we need everything to be reliable, which is basically consistent for each person. We need that also is for our physical and our cognitive tests, which we have up here. We need it valid, which is very relevant per job. So we have to make sure that all the activities obviously are relatable according to people's safety. And then in general, the overall validity of our physical and cognitive tests are crucial because they support the company, because they're not but the independent of each other, physical and cognitive tests don't really work. So you have somebody who's really strong, they can't really, if they can't rationalize in a good way, it doesn't really fit together. And so we have our situational group interview and then also the physical ability test. And one thing we were going to do from there is from the initial one-on-one interview, we were thinking about having a 2-in-1 interview session, which includes these in one, because it'll save costs for the company. And it's like a zip line type of day where we take them out and we observe them and how they work as a team, how they do problem solving, and also do their physical ability test during that as well. It'll be kind of like a separate interview that we can have different managers observing and keep a scorecard for, and that would be really helpful. And then for our main interviews, we have to obviously ask the same questions in the exact same sequence. Otherwise, it would be kind of irrelevant to do any of the scorecard things that we'll be keeping. And in addition to the cognitive ability test, were these 4 questions that we're going to ask during the interview. I know you can't really see it very well on the camera, so I'll read them out loud. And it's if you were in the wilderness and could pick 5 items only to have on your person, what would those 5 items be? And then also, how would you handle a team if they were a distressed customer or a coworker, if you had another employee that was having a problem? question is, what would you do to navigate out of the wilderness if your GPS devices became broken or they were obsolete and you could no longer work them? And then also with treacherous weather conditions, how would you respond if you were responsible for a 5 to 10 person team? And so essentially these are simulations to try to get the person to see how comfortable they are, how much they can rationalize, and think on their feet as far as different situations that would probably occur during any of the events that we have to send them out on.
One of the jobs that we picked to describe the training for was the EMT, because we're going to need one on almost all the adventures that we go on. So their task is basically to take care of anyone that gets injured, and that includes administering first aid, performing emergency diagnostic and treatment procedures, immobilizing a patient for transportation on a stretcher if need be. They're going to need to assess the nature and extent of illness or injury, and they're going to need to, most of all, comfort the patient. The kind of adventures that we go on, there's guaranteed going to be some significant injuries, broken bones, compound fractures, sprains, possibly even burns or something like that. So EMT is going to be very necessary. And the thing about our business is that the people that we take on these trips, they may be experienced, but no one's ever ready to see a bone sticking out of someone's body or seeing someone paralyzed. So you're always going to need someone there who knows what they're doing, and that's the comforting the patient. And that's not just comforting the person who's been hurt, but also comforting everybody else, and kind of taking the leader